Thank you, Member, and condolences. I call the member for Noosa.
Thank you, Acting Speaker. Hundreds of thousands of Queenslanders are putting the together back into our COVID mantra. Segregating people in our communities based on vaccination status is not what Australians aspire to. Never in any roadmap did it say that as international borders opened, we would lock out loved ones from cafes and libraries, nor be able to travel in our own country, or that telehealth would not continue to be used by our psychologists when we have a chronic shortage. None of these decisions passed the pub test, nor does the divisive labelling used by governments and media of vaxxer, anti-vaxxer. It is discriminatory and misinformed. Across Queensland, many who practice wellbeing through natural therapies do not normally participate in vaccinations, just as some religions do not. Noosa is renowned for its healing and wellness retreats, as well high vaccination rates. Our respected and educated practitioners, such as chiropractors, holistic dentists, therapists, social workers and naturopaths, focus on prevention through education, nutrition and alignment to develop strong immune systems as part of healing. These professionals, who look after us and our loved ones through domestic violence, cancer and other health battles, daily work with those who have transmittable diseases, including HIV. They do not reject them, they mitigate the risk. They have hundreds of thousands of patients, clients and staff who do not or cannot put any form of toxins into their systems, including sugars, metals, chemicals or preservatives, as part of their beliefs and recoveries. They are not anti-vax, they are pro-natural and pro-choice. Queensland struggles to meet the demand for health services to accommodate our poor lifestyle choices that diminish our immune systems, lead to preventable chronic illnesses and death. One would think we would support those working to decrease our reliance on interventions, medications and hospitalisations. Instead, we are ostracising these Queenslanders by labelling them, often referring to them as hippie in the hills or renegades. These practitioners and associated research are vital components in a world that will continue to face pandemics and mutating viruses. The Australian Institute of Tropical Health is utilising nature and Indigenous knowledge in developing medicines. The Institute of Medical Research is spending millions on a treatment to get our immune systems fitter to deal with viruses and other diseases. Who knows, we may ultimately not need vaccines at all. Until then, Acting Speaker, I ask the handful of extremists from both ends of the spectrum to stop spreading fear and drowning out those that seek ways to keep our communities safe without segregation. We entered this pandemic together and can only get through it together, masks and all, not by dividing our communities and families, devastating small businesses and vilifying what has been termed a minority. We are much, much better than that. Thank you.